Hi friends, I'm going to do the assessment station, that is fall and fracture. Okay, so if you're getting the assessment station, the scenario will be fall and fracture and the query hip fracture. Okay, or hip fracture and waiting for the surgery. That will be the patient history will be. Okay, so in that cases you will be doing the news chart. So documentation, you will be doing the news chart. Based on the news score, you will be giving the escalation as well. In the fall and fracture, there will be a really important is patient is waiting for the surgery. So make sure when you are doing the assessment, you should consider for what you're supposed to write in the planning as well. In this particular case, you will be getting the planning also pre-op stage only. So make sure consider based on that when you are doing the ADL discussion or the when you having the discussion with the patient. Okay, so altogether it will be 20 minutes time. You will be getting patient history paper and the assessing care patient paper, and you will be having the news chart as well. Okay, so I'm just going through now from the beginning onwards. Okay, so you will have the examiner will say that you will have 20 minutes time, and within that 20 minutes time you will be able to read the history of the patient. Once you read or read and you are comfortable already, you can start the assessment station. Okay, so so as soon as they say that 20 minutes starting, so you can start to reading the history of the patient. You will be having the assessing care. If you need to scribble anything on your assessing care paper, you will be able to do it. That paper is not calculating for the your marking criteria. Okay, so that is only for your reference you are scribbling, but main document is the news chart for this station. Okay, so I'm just going ahead now. So my 20 minutes started now. So I'm just going to read the first page you need to read properly. Then second page is the main history of the patient. So you need to be very carefully read that properly. Then only you will be able to get the history of the patient correctly. So I'm just going to do the 10 o'clock observation for the patient. So patient is Joe Smith, date of birth. So presently the patient had a fall at home and fractured hip, waiting for the surgery. Joe expressed feeling hot and more tired than usual. Feeling emotionally low, currently in bed rest. She's not able to move around because it has to be kept it straight, the fractured hip. Patient had the past medical history of Parkinson's disease, hypertension since 2005. Social history is normally lives and cares for partner who suffers with a slightly cognitive impairment. She is concerned with partner. Partner currently staying alone since Joy is admitted to hospital. Joy is concerned about the partner. Lives in two-story house. Drinks at least 3 to 4 pints for larger every day, and no cigarette smoking. Drug history: oxybutynin 2.5 milligram twice a day. Timolol 0.5% eye drops, 1 drop both eyes twice daily. Paracetamol 1 gram as required. Lansoprazole 30 milligram once a day. So allergy is penicillin, and shortness of allergy. If the penicillin taken, she can get short of breath. So I gone through the history of the patient. So I am ready for the assessment. So I'm checking the scene safety. Scene is safe to enter. So I'm gelling my hands. And this station, you don't need to wear the apron and glove. It's the assessment station. You don't need to wear the apron and glove. So as I always say, as I am looking to the camera, that's the reason I am facing you. Otherwise, you're supposed to face to the patient all the time. And it's saying the green pen. So if whatever the pen they are keeping there, accordingly you need to use that one. Nowadays, sometimes they will keep the green pen. If it is green pen, then you need to must use the green pen. Or you can just check with the examiner that can I have the green pen. Okay, they will say that whatever the pen kept, you can use that one. Yeah. So hi, I'm Bindu Matthew, the nurse looking after you today. I'm here to do some of the observation. Are you able to hear me? Okay, that's fine. I'm here to do some observations. So that is called that is blood pressure, pulse, temperature, respiration, and the oxygen saturation. Is that okay? Can I go ahead? Okay. So before I go ahead, I need to check your identity. Is that all right? Okay, that's fine. So can you check your ID badge as well? Okay, that's fine. Okay, can you tell me your full name, please?
Joe Smith.
Okay, thank you. And can you tell me your date of birth, please?
23rd of July 1972.
And your NHS number is 256810. I can see that you are my right patient. How can I call you?
Joe.
All right, that's fine. Thank you, Joe. So, Joe, before I go ahead, are you allergic to any food, latex, or plaster?
Yes, penicillin.
Or are you allergic to the medication called penicillin?
Yeah.
Okay. So, what happens if you take any medicine that contains penicillin?
Shortness of breath.
Oh, I'm really sorry to hear that. Is that okay? Can you check your allergy band as well?
Yeah.
Okay. It's clearly mentioned that you are allergic to penicillin, and my documents also clearly mentioned that you are allergic to penicillin. So we will make sure we won't give any medication that contains penicillin while you are admitted in hospital. Is that okay, Joe?
Yeah.
Okay, that's fine. Thank you, Joe. Joe, are you in any pain?
Yeah.
Okay. You got some hip pain because you had a fall and you've got the fracture, isn't it?
Yeah.
So is it when you resting? So make sure you should keep your that right hip is quite straight itself. Do not bend or anything. If I'm saying 0 is the no pain and 10 is the worst pain, how much you will score?
6.
Okay, I can see that it's you're in really moderate pain, and I will make sure I will get some pain relief as soon as I done the observation. Are you able to bear it now?
Yeah.
Okay, that's fine. Okay, Joe. So before I proceed, so I'm here to do the set of observation, and I'm going to the A2E as well, that is airway, breathing, circulation, disability, and exposure as well. I'm going to arrange all the articles, and if I need, while I'm going to do the arranging the articles, if you need anything, you can press this bell. Either myself or one of my colleagues will come and assist you. Is that okay?
Yeah.
Okay, that's fine. So I'm nearby only, so I'm just arranging everything. So it will take 15 to 20 minutes. Is that okay?
Yeah.
Okay, that's fine. Okay, Joe. So I'm doing my hand check. Examiner, can you confirm the equipments are cleaned and calibrated over 24 hours?
Yeah.
Okay, that's fine. Thank you. So I'm supposed to do the hand wash here, and if there is no hand wash, you can do the hand gel and come back. Okay. So I will be keeping like that so that you will be able to see the machine as well. Okay. So do the hand gel again. Joe, I'm just going to give you the privacy while I'm doing the observation. Is that okay?
Yeah.
So I'm just drawing the curtain for you. Joe, do you have any preference on your hands? Because I need to do the blood pressure. Is that okay? Can I go ahead with the left hand?
Yeah.
Okay, that's fine. So before I go ahead, have you had any recent surgery on your left hand? No. Yeah, that's fine. Thank you. Okay, Joe. Is that okay? Can I just expose a little bit on that hand? Okay. I can see that there is no cannula or fistula, and I can see that there is no skin lesions or any swelling or any skin problems on this arm. So I can proceed with this one. So I am pressing on with this blue button. Okay, Joe. So I'm just going to put this BP cuff above this antecubital fossa. I'm just covering the 80% of antecubital fossa, and I will make sure this arrow towards the brachial pulse. You will be getting the actors over there. In assessment station, you will be getting a real actors. It's not a real patient, but they will be acting as a real patient. Okay. So here it's the mannequin, but you will be getting a a real acting patient over there. Okay. Okay, Joe, I have applied the BP cuff above the anticubital fossa 2.2 to 2.5 centimeter above, and I have attached the BP cuff and the arrow towards the brachial pulse. So, Joe, am I okay to press the green button? So while I am pressing the green button, the cuff will inflate and it will make you a bit tightness on your hand. Is that okay? Okay, that's fine. I'm not pressing it now because it won't be giving any reading. That's why I'm just, so you're supposed to press this green button. Okay. Okay, Joe, while I'm doing this, the BP, is that okay? Can I check the saturation on your other hand? All right, okay, that's fine. Is that okay? Can I use your index finger? Okay, that's fine. I'm just going to press a little bit on your index finger. Is that all right? Okay. 1, 2, 3, 4, 5. I can see that the capillary refill is less than 2 seconds, so I can use that finger. So always make sure the light is on and keep that probe over there. Joe, while I'm doing the blood pressure and the saturation, is that okay? Can I check your temperature? It will be on the forehead. It will be the infrared thermometer. So I'm just keeping the thermometer away from 3 to 5 centimeter away from your forehead. I'll make sure there is no hair or anything and there is no skin lesion, so I can proceed. Is that all right? Okay. So I'm just going to. So you will be getting the display on your thermometer. Okay. So. Joe, I have completed all your, so if you say that if it is 36.8 the temperature and if it is 96 for the saturation and the BP was 130/80. Joe, I have done all your BP and saturation and the temperature. I just need to do your pulse for a couple of minutes. Is that all right? Okay, so can you keep your hands on your chest like this? Yeah, that's fine. So I'm just palpating your radial pulse. Okay, I will be quiet for a couple of minutes and I'm expecting you to be quiet as well. Okay. Okay, Joe, I have completed 2 minutes. So make sure you should be waiting complete 2 minutes like that. Do not take off your hands from there. So the first 1 minute you need to check either the pulse or respiration. So whichever the way you can do, but make sure you should be doing 1 minute for pulse, the pure 1 minute for pulse and complete 1 minute for the respiration as well. Okay. So once you completed that one, Joe, I have completed the 2 minutes. I have checked your pulse for 1 minute and another 1 minute I checked your respiration as well. I haven't told you that I'm checking the respiration as well to avoid any interruption on your respiratory rate and depth of the respiration. Is that okay? All right, okay, Joe. So, Joe, can you open your mouth and can you try to cough out? Yeah, I can see that you are talking quite normally also. I just need to verify that there is no obstruction on your airway. Yeah, that's fine. Thank you. So, Joe, I have completed all your observation now. So I just wanted to, so I have completed airway, breathing and circulation. I just wanted to check your disability as well. I can see that you are alert and oriented because I was talking to you throughout and you are fully alert and oriented. So I'm not worried about that. How is your urine output? Okay, so you're passing urine quite normal. Yeah, okay, that's fine. And do you know what is your blood sugar? Okay, that's fine. Thank you. And so I just need to check your exposure as well. I have already checked your temperature and I just need to check your whole body. Is there, have you feeling any bruise or any bleeding or any kind of bruise or anything on your body? Okay, that's fine. Thank you, Joe. So I'm just going to completing my document. Is that all right? Okay. So do the hand gel. This time you just need to complete all your documentation. So documentation is the new start, you need to be completed. So make sure full name, date of birth, date of admission, that is your exam date. So always make sure only one column you should use, the first column only you should use throughout. The date, time, within that the column itself. So first you need to complete the respiration. You need to put only dot and SpO2. So you just need to use the scale 1 for your OSCE. So complete the SpO2 in dot and make sure air or oxygen. If the patient is in air, you either you tick or you put A or you put the dot in there. Now you come to the blood pressure. Always make sure put the blood pressure on the 2 little arrows up and down. Then you come down the complete with the dotted line. Then pulse in, you put the dot in correct place. And conscious or alert, always make sure if it is a alert you put A or tick or the dot. If it is patient confused, then you just need to put the dot against that one. Then temperature, always you put the into mark according to where it is. And now you need to calculate the all new score. So if the respiration is high, accordingly, so respiration, SpO2, in the blood pressure, only you need to check the systolic pressure for the scoring system. You don't need to worry about the diastolic. So you just need to check about the systolic pressure, and accordingly you need to calculate the score. So altogether you need to add up and you complete the new score there. Then monitoring frequency, you will have the monitoring frequency accordingly. If it is a 1 to 4, accordingly you just need to put. If it is a 3 in any single parameter, that is mean if the respiration itself it's a 3 scoring, then it has to be 1 hourly, yeah, or if any of them. Then you need to do the your escalation, always it should be S, and the initial you need to be completed as well. So you completed all your documentation, and according to this patient the monitoring frequency is 12th hourly, the new score is 0. So that's the reason the patient hasn't got anything. So patient is waiting for the surgery, isn't it? Yeah. Okay, Joe, I have completed all your documents. I have completed all your observations as well. And I have checked your AQE assessment as well. I can see that your airway is clear and patent. I cannot see any obstruction on your airway. And for breathing, I have checked your breathing pattern and rhythm and respiratory rate. So that's quite normal, and I cannot see any. We are not using any accessory muscles, so and there is no added sound. And it's a chest movement that are equal. And I have already checked your saturation as well, and that also 97%, so that's absolutely fine. On circulation, I have checked your blood pressure, and it's 130/80, and it's quite normal. It's little bit slight. I can see that you are waiting for the surgery, and you might be little bit anxiety. So that might be gone the systolic little bit high. Are you normally hypertensive? Yeah, I can see that it's a little bit high as well, isn't it? Okay, that's fine. And also I have checked your pulse as well, and pulse is within normal range. It's 78 per minute. And also I have checked your temperature, and it's quite normal, that is 6.8. How is your urine output? It's quite normal. Okay, that's fine. So I'm pretty much okay with all your circulation. And for the disability, have you got any problem with your the limbs, limb movement or anything? I can see that you got a hip fracture, and because of you are not at all able to move that side. So try to stay like that only. So that's fine. And I can see that you are alert and oriented. There is no there is no confusion or anything. So I can see that there is no problem with the disability. For the exposure, I have checked your temperature. And can I have your Do you know, is anybody checked your blood sugar? Okay, that's fine. Examiner, can I have the blood sugar of the patient? Okay, that's fine. So that's quite normal. So that's okay. And for the exposure, I have checked your temperature as well. And also, I would like to check your head to toe examination as well. Would you able to more? Can you confirm that is there any bleeding or any bruise or anything on your body? Examiner, can you please confirm? Okay, that's fine. Thank you. Okay, so I have completed all your A2E assessment, and here I have done all your observation as well. So your new score is 0. As you know, everything is quite normal, so that's why. And we will be checking every 12th early, but you are waiting for the surgery, so we will be in that. We will come and assess you in between as well. If the and we will be more. Because of current observation, it's. New score is 0. We will be checking that 12 hourly, but as you are waiting for the surgery, we will be checking in between as well. Okay, and your escalation is that's fine. Okay, Joe. So I have completed everything now, and so before that, I just need to before I am going, I would like to check your activity daily living. Is that okay? All right, that's fine. Okay. As I already discussed with you all, I can see that you are not able to walk around or anything. You have to stay in bed because of the, you had the fractured hip. So make sure whenever you need any assistance, please press the bell. Always keep the bell within your reach. So that, anything you needed, you can press the bell. Is that all right? You said that you got some pain, isn't it? So I will make sure I will bring some pain medication for you. If it is possible, injection, but because you are on, nil per mouth for waiting for the surgery, I won't be able to give any oral medication. But I will see that if it is, I will have. We already given some pain relief for you. So if we check that after half an hour, and I will come and check it again, and if needed, we will arrange some pain medication for you through muscular or intravenous. Is that all right? Okay, that's fine. I can see that you are a bit anxiety about your surgery, isn't it? So no need to worry. We are here for you, and I will go through with all your checkup for the pre-op checklist and everything, and the anesthetic team will be come and assess you as well. And I will make sure all the pre-op check has been completed and the pre-op preparation has been completed. So make sure you shouldn't be eat and drink at all. And since last night you've been kept NPO, so we will be starting the IV fluid as well to make sure you will be well hydrated. Is that all right? So no need to worry. So make sure we are not drinking at all. Okay. All right. I can see that you already said your urine output and is that the bowel also normal? Okay, that's fine. And Joe, are you having any bad habit like how about your smoking and drinking? Oh, you don't smoke much. Yeah, okay, that's fine. And you occasionally taking the drinking. Yeah, that's fine. That's absolutely fine. So Joe, I can see that you got some concern about your partner, isn't it? Okay, so for that, have you got any social worker? Okay, that's fine. So we will get in touch with your social worker, and we will arrange somebody to visit your partner, and we'll make sure that they will your partner is all right, and somebody should take care of him. Is that all right? No need to worry about those things, and make sure you should be relaxed and wait for the surgery. Yeah. Have you got any other concerns? Okay, that's fine, Joe. So I have done everything, and I will be here only. If you need anything, you can press this bell. Either myself or one of my colleagues will come and assist you. Is that all right? Are you comfortable there? Okay, that's fine. Thank you, Joe. So I'm just going to dismantle all the articles, and I'm going to wash my hands. Okay, thank you. And I'm just going to dismantle all the articles, and I'm going to wash my hands. Hope you are clear about everything. Thank you.